Good afternoon, everybody. I'm very happy and privileged to teach you a little about our new renovations and new exciting the things that we are doing in Hadassah Medical Center. My name is Professor Aaron Popovцер. I am the chairman of the Cancer Institute, the Cancer Institute named the Sharet Institute. I myself am a specialized in both medical and radiation oncology. My specific specialty is in head and neck cancer. I would like to tell you several of our new things that we are doing here in Hadassah. So as far as radiation, maybe we could introduce two really interesting new treatments that we offer. The first treatment I would like to introduce is what we call alpha particle radiation. As you all know, all radiations work through what we call photons. Photons are very good, but they have some issues that make them not ideal all times. They can cause toxicity because they have a strong effect on the tissue around them, and sometimes they don't work just because some of the tumors are radio resistant. What we offer here in Hadassah for many indications is the use of alpha particles. Alpha particles we have to insert into the tumors. We use this especially at this point for skin cancer and head and neck cancer. We're doing this now also for pancreas cancer and for liver cancer. What happens with these particles is that we insert them into the tumor, and while they are inserted into the tumor, they have a very strong effect because the biology of the alpha is in some ways better than the regular photons. So they biologically work very strong on the tumor. And however, at the same time, since their spread is dependent on the blood vessels of the tumor, they do not spread to the surrounding tissues, and therefore they cause less damage to the surrounding tissues. And this is fascinating because we can see that we can cure cancers that failed with regular radiation with this new technique. At the same time, we have a big advantage that we don't see toxicity around. Most of these treatments are performed under local anesthesia. Patients come for 2 weeks, and then they can go home with a very strong potential to be cured. The second interesting issue I would like to discuss with you is our new radiation system called the Ethos system. Ethos is used at this point mainly for head and neck cancer, for bladder cancer, and for prostate cancer. What is unique with the Ethos system is, I'm sure that as you know, in most cancers, when we start treating them, we offer the same treatment for the whole session of times. And unfortunately, and in some ways it's good and sometimes it's bad, the body changes during treatment. Sometimes the bladder moves, sometimes the rectum moves, sometimes the body shrinks because patients lose weight. Furthermore, some of the tumors themselves change dramatically. Let's say you treat what we call a tumor in the tonsil or the base of tongue or the nasopharynx. These tumors shrinks during treatment. Now, in a regular classic treatment, these tumors are receiving the same radiation to exact same anatomy during the whole 35 sessions or 40 sessions, depends what area and what's the indication. And then if the tumor is changing or the anatomy is changing, then actually in most cases the tumor will be treated because we will have a lot of toxicity because there is a change in the body, and then part of the radiation will go out and not treat the tumor, but will treat the surrounding tissue. In this new technique, we actually do a simulation. We do a treatment planning every day. It's very sophisticated. It's what we call BI. It's intelligence. And through this intelligence, actually, the radiation machine, our system, the Ethos, creates a new treatment planning every day. And our doctor follows these treatments every day, and he can organize and change the treatment according to what he sees and according to what is created by the machine every day. And then we have the option to choose either to go by the original treatment or to go by the newly created treatment. And what we see with this, and we have treated many head and neck cancers and many bladder cancers with this, up to now, that we're able to shrink the treatment size and therefore cause less toxicity, and at the same time we get excellent results. We are the first place in the world to treat head and neck cancer with this machine, and this makes it excellent and very unique for us. Another new option we have in radiation is what we call IORT. We have intraoperative radiation therapy, and this is a new technique in which we use it specifically for patients who failed radiation. We will put them into surgery, and then at the end of the surgery, while it is open, whatever it is, it could be a neck, it could be the pancreas, it could be any place in the body, we add on local radiation, which is exactly focused to the area in which we suspect that our surgery will not work. This is given in one shot with a very high dose, and this is great because this gives an opportunity to treat patients who failed on radiation. And the reason we can treat this is, first, it is localized, and second, it is a very high dose, and therefore sometimes you can fail with regular radiation, and with this technique, which has a different biology of the way it works, we can succeed. We do this routinely now for pancreas cancers. We do this now during surgery. We do this specifically for most of our patients in which patients have failed radiation. Some of these cases come obviously from other places, and then we will perform surgery, and during the surgery we will set up this radiation. Other innovations I would like to speak about are not from the radiation field. We are starting now several very interesting studies in the field of immunotherapy. We perform what we call personalized immunotherapy. We check the patient's specific HLA, so we learn more about the biology of the patient, and then we can actually not only give immunotherapy, but we can give the optimal immunotherapy for the patient according to what we see in these patients. Other than that, Hadassah Medical Center has started a new program in which we perform genomic sequencing for all patients who come in with cancer. And with this system, we offer the patients ahead of time the opportunity to understand their cancer better, because we understand the whole biology of this. And this can give us some ideas from the prognostic factors of the chances of the patients to be cured. Sometimes we add on specific adjuvant treatments according to what we find and according to these changes we see in the genome of the patients, which could suggest to us if the patient is highly suspicious for recurrence, and according to that we can adapt a specific treatment for this. Moreover, for our metastatic patients, today we have many treatments to offer based upon these genomic sequencing changes we find. Today, as you all know, treatments are addressed to the patients and are tailored to the patients according to the changes we have seen. And due to the fact that we have performed so many genomic sequencings today, we have many agreements with many drug companies to offer treatments that are not standard and that are not existing in the standard reimbursement system. These are all new things and unique for Hadassah Medical Center, for our oncology center, and we will be happy to help and treat you. Thank you very much. So lately we have several doctors we have recruited to our center. We have recruited a radiation oncologist who specializes in lung cancer. His name is Dr. Philip Bloomfield. He came in from Chicago, United States, where he advanced in all these new technology in treating lung cancer. Specifically, he focuses on breathing motions, which will improve our treatment. He also focuses on radiosurgery for these tumors. And his focus is, again, as I mentioned, on lung cancer and then pancreas cancer. In our breast cancer field, we have recruited Dr. Shani Palach, who is a unique in the fact that she is one of the leaders in Europe in breast cancer. She's a medical oncologist with outstanding criteria and outstanding credits. She specializes actually in treating young patients with breast cancers, and she will be able to actually to suit your treatments according to your age, according to your personality, and she specifically focuses on ladies who want to give birth again and want to live their lives as young patients and still treat and cure their cancers. So, as I mentioned earlier, my name is Aaron Popovцер. I'm unique in the fact that I am both a head and neck otolaryngologist, specializing in, I finished an ENT fellowship, residency actually. I'm the only one in the world, and I've also finished medical and radiation oncology. So I actually treat head and neck cancers from the whole spectrum of all these specialties. I am specifically, I have special issues in which I am focused on. I have a lot of experience in salivary gland cancers. We see patients from all over the world for this disease, and we have specific studies for these patients. We focus strongly on thyroid cancer, and obviously for recurrent head and neck cancers, we have many protocols which include, as we mentioned, alpha radiation, re-radiation with our standard photon therapy and brachytherapy, and we combine our personalized biology treatments with these specific radiations in order to improve and prolong life, and at the same time improve quality of life. I will be happy to help you in my field. So I've treated many patients from Russia. I would like to mention a case, a very interesting Russian patient who came with a very large tumor of the parotid, which was considered to be a squamous cell. The initial plan in Russia was to perform a very large surgery, which would cause actually a nerve palsy, since the seventh nerve, which sits exactly near the parotid, it was involved with this tumor. In this unique case, I decided to do something a little different, to start treatment with immunotherapy prior to surgery. The patient was here for 2-3 months, received 4 courses of immunotherapy. Then we have noticed amazing shrinkage of the tumor. It was bearable, notable. And after we finished these 4 courses, we went forward for 6 weeks of radiation. And as of today, we are following this patient for over a year. Now he's sending PET scans from Russia. We do not see disease. The patient looks great. It's a great feeling for us also to see that we were able to change the whole paradigm and course of treatment and take a patient who probably would not be able to undergo surgery and cure him through this system.